So today we're exploring occupational and physical therapy as anxiety reduction practices, and we're speaking with John Schilkowsky, the clinical director at Pappas Occupational and Physical Therapy in downtown Barrington. Welcome, John.
Thanks, Tom. Appreciate it.
Well, let me jump right into it then. What does the general public think about the practice of occupational and physical therapy? How do they find their way into the practice?
The majority of our patients come via referral from their primary care provider or an orthopedic. There are some who come in via direct access, which is basically coming to physical therapy without having a referral. I believe nearly all states have the ability to come directly into physical therapy without a referral.
I know that pain is a powerful catalyst, and traumatic pain even more so. In what ways is anxiety connected with pain that brings people into physical therapy? How do you get a feeling for the anxiety that people are carrying?
Sure. So during my initial evaluation, I always want to know why the patient is coming in and what pain they're experiencing. Additionally, I also want to know what is going on in their life. I, I always ask my patients, do you live with someone? Do you live alone? How is your day-to-day activities? How is that being affected by your pain? What are your work duties? All of these things to kind of get a sense as to how a patient's psychosocial factors could play into their pain. When I say psychosocial factors, I mean the other things that are going on in their lives, whether it's difficulties with relationships, difficulties with anxiety. All of these our body can perceive as a threat. And a part of that can manifest itself in that pain experience. Basically, one thing that I talk with all my patients is pain is our body's response to an external threat. One story I use with patients is if you were to step on a nail, the way that you would know that you step on a nail is that the nail triggers a response via our nervous system. The nerves bring that right up to the spinal cord. Spinal cord delivers that message up to the brain. The brain then has to decide whether, this is a threat or it's something that we can just kind of brush off. And pain is a protective mechanism. And when we are experiencing anxiety, that protective mechanism, that alarm system that goes off in our brain can just be a little bit aggravated and irritated.
I'm going to come back to that in a little bit, but first, we're in an area of instant fixes. How rapidly or slowly are therapy cycles, and what tends to recover first, the anxiety or the pain?
Typically, every patient is different, so it's tough to say typically. The average physical therapy's plan of care lasts between 10 and 12 visits, and everybody's different. Depending on the amount of pain and their specific impairments that we're trying to treat. Usually, we find that the anxiety can oftentimes linger for quite a while. And I try to focus less on improving pain with patients, more improving function. So I realize that's not a direct answer to your question, Tom, but when we look at trying to address pain, address anxiety, the overarching thing that can affect those is how what we're experiencing impacts our day-to-day lives, right? So my goal is, and I tell patients this all the time, I want to get you back to doing whatever it is that you want to or need to do in your day. By addressing those functional limitations, typically folks tend to have improvement in their mood, right? Like if somebody is not able to go out for their daily 1 mile walk, and we do exercises to help improve walking, typically mood is going to improve. And the fact that we are addressing, some of the mechanical issues that we've got going on, that can sometimes improve patients' pain.
So different physical therapy practices do offer different therapeutic approaches. And your approach includes dry needle therapy. How is this practice different from acupuncture?
So the dry needle therapy uses an acupuncture needle. Basically, the idea is we're using that needle as a mechanical stimulus to find a spot in the muscle, which is called a trigger point, which is a area of a muscle that is receiving a whole lot of input from our nervous system. Usually, this leads to the muscle being really tight, sore. Sometimes it can even radiate symptoms to other places. Now, the difference between acupuncture and dry needling is, and I can't speak very effectively to acupuncture specifically, but from what I understand, it relies on a lot of alignment of chi and flow of energy throughout the body. Whereas while we use the same tool, we are looking for that mechanical stimulus, that kind of getting the muscle to twitch, and oftentimes it can be a little bit uncomfortable while it's taking place. The utilization of the needle helps facilitate a physiologic reaction, which then allows, once we get that twitch, the muscle to be a little bit less angry, less irritated, and just helps it calm down a little bit.
Dry needle therapy provides a rapid sensation of relief, which understandably can relax some forms of anxiety. But does this rapid relief actually relate to curing the underlying problem?
Usually the needling in itself is not going to cure the anxiety. Typically, what we find is that by addressing a person's function, by using the dry needling to help them be more functional, to be live with less pain, that can help calm down senses of anxiety and feeling that I'm not able to do what I want to do, and looking to seek other ways of dealing with pain and dealing with depression.
I'm seeing some forms of anxiety care that emphasize training and others that emphasize coaching. What type of a balance do you seek for your patients?
I try and balance those equally. Tell my patients when we start working together, we're working together as a team. I'm going to be coaching you through this. Now, of course, I'm going to also be training you. I'm going to prescribe exercises specifically to work on addressing a person's impairments, addressing their physical limitations. But I also want to make sure that there is a sense of ownership in the process. And a big part of that is coaching them through managing barriers to accomplish their goals, whether it's management of time, management of other outside life factors that can get in the way of keeping up with the exercises, keeping up with the program. I try and approach it with a team approach.
Occupational physical therapies are, of course, a means towards a recovery. And you touched on this a bit, but after the initial treatments, what do patients take away with them? Do they take on new self-care habits? Do they connect up with secondary lifestyle support providers?
That is absolutely my goal with all my patients. I tell folks, if I'm doing my job right, we develop strategies here in physical therapy that you can carry on throughout the rest of your life, whether it's adopting an exercise program that helps manage the impairments that you're having, whether it's finding an exercise that helps alleviate your pain and that can be used as a go-to. I do love when I can send a patient off and we've developed that strategy. And I often do encourage them to find other ways to stay active, whether it's working with a personal trainer, whether it's getting involved, at the local YMCA, whether it's making those lifestyle changes like taking a daily walk, or even for folks who do office work, getting up and stretching every 15 to 30 minutes. Those are the things that I really try and push with my patients.
Thank you, John. One final question. What advice would you give to someone who might seem to have a relatively small amount of pain, or something that a primary care might not consider a significant pain, yet they might possibly have an oversized anxiety about that pain?
First of all, I never want to play down a patient's pain experience. Your pain is real to you, no matter how big or how small it is. If you are having anxiety around your pain, I really advocate for seeking out a qualified care provider, whether it be a physical therapist, an occupational therapist, whether it be a chiropractor, someone who you can share your pain experience with and really work towards addressing the physical limitations that might be contributing to your pain, but overall working towards improving your function. If you have a goal and your pain or physical limitations are preventing you from reaching that goal, I recommend working with a qualified care provider in order to help meet that functional goal and help you live your best life.
Well, thank you very much, John. I really enjoyed having you today and wishing you and everyone who has pains a speedy recovery.
Yes, sir. Appreciate it, Tom.
Yep. Bye-bye.
Bye.